Welcome to another Rush Generations Health Education Lecture. Rush Generations and our staff is delighted to be your source of information, resources, and health promotion programs that help maximize your well-being and good health as you age. Today is Wednesday, August 5th, and I am Grisel Rodriguez Morales, Rush Generations Program Director. I'll be your moderator for today's lecture, Immune Health and Aging. Before I present to you the wonderful speaker joining us today, I'd like to first thank our lecture producer, Hannah Weitzman. Hannah is going to help us manage the chat and other key aspects so that we all can have a great discussion about how aging affects immunity and what we can do to support a strong immune system year-round. As always, we're live streaming this lecture via our YouTube channel using the video platform Zoom, which also allows us to host a good number of people joining us via phone. Thank you for joining us. For those of you on YouTube, we ask that you please use the chat function to ask questions and or to add to the discussion throughout the lecture. We will make sure that your comments and questions make it to the presenter. And for those of you listening to the discussion via phone, you know that you always have an opportunity at the end of the presentation to unmute your audio so that you can ask your questions. Now, we'd like to remind all of you that all the information offered here is for general informational purposes only, and to always seek additional professional advice for situations that are specific to you and your needs. So without further ado, let me introduce you to Dr. Shannon Mans. Shannon is originally from Metro Detroit, Michigan. She received her undergraduate degree in biology at University of Michigan and completed her medical school training at Central Michigan College of Medicine. After completing her residency in internal medicine at Rush University, she matched into the Allergy and Immunology Fellowship Program. Matching day is one of the most exciting days that we always have at Rush, and I bet in other institutions. Shannon is especially interested in the way that ecology and climate change can impact allergic disease. In her free time, she enjoys running, biking, and being outdoors. So help me welcome Dr. Mans. Thank you so much for being here with us.
Thank you so much, Grisel, for that wonderful introduction. I'm so happy to be here, and I'm very excited to get into this topic that I think is very important to review and give us all some autonomy and control over our own health as we age, which is another very important thing. So Hannah, thank you so much for controlling the slides today. And today specifically, we'll be discussing how the immune system changes with aging over time. And once again, thank you so much for having me, Rush Generations. So this is our agenda today of what we're going to discuss. To start, we're going to review the immune system as a whole. So just step by step of what the basics are and how the immune system regularly functions. Then we're going to review what happens to your immune system as you age, or how the immune system changes. Thirdly, we'll discuss how you yourself can strengthen your own immune system and prevent the changes that do naturally occur as you age, or at least slow them down. And then lastly, we'll talk about when to seek professional care. Okay, so the first thing that we'll review is the immune system as a whole, or as a general overview. I really like to think of our immune system as a security system of the body. So I'll be using a lot of synonyms or metaphors for all the different cells and parts of our immune system today. To start, what we have in our body that is sort of the first line protectors, or what I consider to be the bouncers, are the barriers of the immune system. So what this means is they're the first line defense. So skin, mucus that could be in your nose, your mouth, your throat, your airways, stomach acid, hair, things like eyelashes blocking out from the mucous membranes like your eyes, hair on the head, hair in other places too to protect you. So this is the first line barrier, the first thing that either viruses, bacteria, and other potential infectious issues present to your body. So that's the first line, or the bouncers. So what happens if these germs pass the bouncers? Then what do they meet? They then meet what we call the first responders, or the innate immune system. So if the germs get through those initial barriers within a few hours, the body will recognize them, and if functioning correctly, will attack them. So what this typically looks like from your perspective, it's when you're first developing symptoms of an infection. So you may feel warm, you may develop a fever. If it's a localized infection, you could develop swelling in that area, redness, pain, tenderness. Although this is unpleasant and oftentimes seen as an unfavorable symptom, this actually means that your immune system is responding or trying to respond to a germ once it's recognized within the body and past those bouncers or barriers. And then lastly, there's the adaptive immune system. And I like to think of this like the CIA or the FBI. And I like to think of the adaptive immune system this way because they're really specialized cells. They may take longer to respond to germs, but that's because they're building up intelligence and memory to recognize these germs in the future. And we'll get into the specifics in a little bit and in future slides as well. So we can proceed to the next slide. So for our listeners, we're now looking at a slide that shows images of these different portions of our immune system. So as a review, what I consider to be the bouncers of the immune system are the external and internal barriers, like the skin, microbiota that are just living in our saliva or our gut, temperature, pH, which is getting a little bit more into the acidity within our body. And there are different things as well that I won't get into the details for. And then stage 2, or the first responders, are that innate immune system. And we'll get in a little bit into the cells that are known to be the innate immune system, or first responders. And then lastly, we also have the adaptive immune system, or those CIA, FBI cells, which are the T and the B cells. And the B cells create what we call antibodies or immunoglobulins. And we'll get into that in more detail in this discussion later. And we can go to the next slide. Perfect. So where is the immune system in the body? This is a hard thing to conceptualize, right? Because it's very small. You can't visualize it with the naked eye. So our immune system, mainly when it's active, moving around outside of those bouncers or barriers, they're in the blood, and they are called white blood cells. And as you can see, there's a figure on the right, and for our listeners, it just shows the components of blood. 55% of blood is plasma, which is mostly water and proteins and electrolytes. 45% are red blood cells or platelets, just red blood cells, and then 1% is the white blood cells and the platelets. So it makes up a very small amount of your actual blood components, but the activity that it brings into the body and the protection services is significant. So they do make up less than 1% of the blood, and I thought that was important for you all to know because it's there, it's just a smaller amount. And we can go to the next slide as well. So now we can review a bit more details in regards to all the specific cells in the immune system. For listeners, we've gone back to the old image that I presented earlier on. And what it shows is all the different cells within that stage 2 or first responders, the innate immune system. So I like to think this like when you're calling 911 and they come in with the emergency or EMS system and bring you to the hospital. they're the first people there when there's a problem, or the first cells who are there when there's a problem. So we can kind of go through a bit randomly, but we'll start with the pink cell in the middle. It's called the neutrophil. This is one of the more important first responders that we have in our body. It can quickly attack bacteria and other invaders immediately upon recognizing them. And then similarly, on the far left, we also have a natural killer cell, otherwise known as an NK cell. And its name really matches its function. It can also quickly respond and see bacteria and other invaders and eliminate the cells that are infected with those bacteria, or even directly. Then there are what we call sort of the garbage men of the innate immune system, or the macrophages. They act like the body's cleanup crew. So if there are any germs that they see or damaged cells with those germs, they will often eat, degrade, and break down those specific cells. And then we can now move on to the adaptive immune system, or the CIA or FBI agents of the body. So B cells, which are on the far left, they, like I said before, produce what we call antibodies, and that's, or sorry, on the right, and then the antibodies are on the left. They're a part of the memory immune system, and they help latch on to certain cells or actual invaders that may bring threat to the body. These are always circulating in your blood, and this is actually what's usually produced after you get things such as vaccines or immunizations. And this just helps link all of these different immune cells together to work in a properly functioning group. And then we also have the T cells, and I think of the T cells more so of the manager. They themselves are very versatile, so they can actually attack as first responders, but they can also tell those first responders where to go and what to do. They also communicate with the B cells too and tell them where to go, what to do, or which antibodies to make. So once again, definitely a specialized cell, and it does a lot for you and your body. We can go to the next slide now. Where else is the immune system cells, or where is the immune system located outside of just within the blood? So as I said before, white blood cells, or the immune blood cells, make up less than 1% of your blood. So where do they reside outside of the blood? They reside in a lot of different areas, and most of them you guys probably already recognize or know. One of the most important ones that I like to bring up are the lymph nodes. So oftentimes when you're getting an infection or you have some sort of attack upon your body, you might feel like your lymph nodes, and there are lymph nodes all over your body, but one of the most recognizable parts of the lymph nodes are here in the neck area. So you can often feel like they're enlarged, they're swollen, they're working overtime to fight whatever infections in your body. There are also other areas where the immune system cells can reside outside of those lymph nodes in the lymphatic system. And that could be places such as the spleen, the thymus, which in adulthood we generally don't have anymore. The thymus tissue reduces as you grow older. Peyer's patches, which are in the gut or the intestines. And then the bone marrow is where all these cells are generated or are born before they go out into the blood. And we can move on to the next slide. So now that we've reviewed what the immune system is and how it normally functions, let's talk about the changes that occur as you age. So first and foremost, unfortunately, as the immune system ages with you, it tends to weaken and slow down. What does this mean? So this means that germs are able to work around the immune system more swiftly, more quickly, and a bit smarter. They tend to start to outsmart the immune system. This can lead to infections that you usually wouldn't see in younger patients or younger people, such as more frequent pneumonias, severe pneumonias, influenza, as we saw, unfortunately, in the pandemic time, COVID-19. And then also, as you grow older, you also hear your primary care physician bring up the shingles vaccine, because this is another thing that your immune system tends to lose its fight for, which is a skin sort of viral reaction, which is very unpleasant and can be very painful. There are also other skin infections such as cellulitis or bacterial infections, other respiratory viruses outside of bacterial pneumonias, and also some foodborne illnesses such as listeria and salmonella. And these foods can be more so perishable: cheeses, meats, things like that, vegetables, unfortunately, sometimes as well. And we can go to the next slide. Thank you, Hannah. What's the second thing that can happen as you age to your immune system? It can also get confused. And what does this mean? It means that sometimes your own immune system recognizes your body or regular organs as foreign or as a threat. This can lead to different diseases affecting different organs in the body, such as your thyroid, your blood cells specifically, your gastrointestinal tract, your nerves, your lungs, your bones, your brain, your muscles, and your skin. So this is a little bit different than when we talk about the germs evading the immune system, right? Because we only really talked about the immune system protecting you from germs, but it also protects or regulates the body. As we talked about the T cell before, it's also known as the manager. And this T cell manager also tells the other immune cells what's foreign or what's a threat and what's not. So as the T cell manager tends to retire as you grow older, it's less efficient at telling your other immune cells what is regular in your body and what is not. So that leads to this autoimmunity. We can go to the next slide. Perfect. And what goes along with this? Also an increased risk of cancers. So as I was talking about in the last slide, your immune system acts like this security system. And every day, your body is constantly making small mistakes in your DNA or the makeup of your cells in your body in the direction or transcript of what your body and cells are supposed to do. Most of the time, these T cells and other immune cells recognize the abnormal cells before they grow or proceed to make other cells that are damaged like them. But as you age, sometimes your immune system becomes less efficient at finding these abnormal cells in your body. And some of these damaged cells may escape detection and continue to grow. So this doesn't necessarily mean that just being older increases your risk of cancer over time. It just is worse at finding those abnormal cells, as you're just constantly exposed to things in life that lead you to be at increased risk of cancer, such as sun exposure, smoking, pollution, environmental exposures. These are just things that we can't avoid, right? Some of them at least. And it's just that your body is less quick to get those cells before they have too much DNA damage. And also with all of this too, chronic inflammation can increase. And the inflammation is just, once again, irritable tissues, irritable immune system, things that go along with autoimmunity, and then also sometimes cancer. We can go to the next slide as well. So what happens specifically to each of the cells that I talked about before? And we can review what each cell function is too. It's not your job to memorize that. But the neutrophils, as I said before, they're one of the innate immune system cells, or the first responders, like the EMS. Unfortunately, with age, they become less responsive. Same thing with the natural killer cells, or the NK cells. They also become less responsive, as well as the cleanup crew. They also become less responsive over time. What happens to those CIA and FBI agents? So those B cells that make the antibodies that are contributing to the memory immune system, they don't make as many antibodies to respond to new germs. So you always have the old antibodies that were made. Sometimes over time they can wane, but they should always be present. It's building up the new immunity to new things that you were exposed to. And then what happens to those managers, or the T cells? They start to retire from their managing job. So that can bring you high risk of developing certain malignancies or cancers, autoimmunity, and also response to germs. Okay, enough of the doom and gloom. Now I want to talk about what you yourself can do to take care of this or prevent all of these changes that I just discussed within your immune system. I shouldn't say prevent, more so slow down the process itself. So, as almost every single physician will talk about, hopefully, one of the most important things that you can do for yourself is the fuel that you present to your body, or good nutrition. And so what does this mean? It's getting nutrients in your diet, such as all of the good vitamins, like vitamin C, D, E, some other things such as zinc, selenium, and omega-3 fatty acids. All of these different things are shown to improve immune function in older adults. So what does this look like for your diet specifically? So for your diet specifically, to get more vitamin C, some vitamin C containing foods are things such as fruits and vegetables. So things such as kiwis, tomatoes, strawberries, broccoli, good oranges, peppers, Brussels sprouts, and many more fruits and vegetables that you can contribute or put into your diet on a regular basis. Next is vitamin D. So you can get this through many foods too, but the most typical or well-known foods that are associated with vitamin D are things such as eggs, specifically the egg yolks, some really good fortified cereals, granolas, salmon, and then also fortified milk as well. Next is vitamin E. And a lot of the vitamin E content is in leafy green vegetables, so things such as spinach, kale, arugula, mixed greens, less so those romaines, but more so that really dense green vegetable. Also, we have almonds, nuts, avocados, peanuts, sunflower seeds. I'm getting hungry looking at these slides, but there are lots of ways that you can contribute vitamin E into your diet as well. Next is zinc. So you can get this from meats mainly, so chicken and steak, beef, as well as beans, lentils, and different nuts. So right here on the slide, I have some cashews, but any other mixed nut too usually contains zinc. And then we have selenium. Some selenium-containing foods include whole grains like oatmeal, quinoa, barley, and then we have shrimp, some salmon, turkey, and Brazil nuts are on the slide, but once again, same as before with zinc, you can eat really a lot of different tree nuts and peanuts to get your selenium as well. And lastly, I'm sure a lot of the people who are on this call have heard about omega-3 fatty acids. And some of the omega-3 fatty acid containing foods include already what we've kind of talked about. It's things like fish, such as salmon, eggs, those egg yolks, tuna, leafy greens, olive oil. So if you're just cooking with olive oil, nuts, seeds, grains, and mollusks such as mussels, you can see here on the slide, and scallops as well. So yeah, that overall encapsulated all of the food and the ways that you can change your diet or at least incorporate these things into your diet every day, which I know can be hard, especially if you're cooking on your own or don't have easy access to a lot of these foods. But overall, it's one thing that you can try to take control of, although I know there comes some difficulties with that. And that kind of leads me into the next topic, is physical activity. So similarly to eating well or healthy, nutritious foods, studies have also shown that regular, moderate intensity exercise helps build immune strength in aging. It's been found to improve vaccine responses. Those T cell managers wait longer to retire. The first responders remain more active, and there's less overall inflammation in the body as well. So what are some things that you can do for this moderate intensity activity? You could do things such as brisk walking. You can use this as time to catch up with friends or family, either by phone or going on a walk with them. Also brings you some fresh air as well and getting out into the community. This can be anywhere from 30 to 45 minutes, 3 to 5 days a week. If you're less into the outdoor activities, you could also do anything inside with a treadmill. Same thing with biking. You could do any sort of stationary or outdoor cycling, 20 to 40 minutes a day, 3 to 5 days a week too. Or if you're more of a water person, you could do swimming, water aerobics, or just really any out of water aerobic classics or classes as well. All of this is around the same time of like 30 to 45 minutes, 3 days a week, whatever you may choose. And then there are also some dancing or Zumba classes too that help keep you aerobic, and that's what I mean out of the water for aerobic exercises. This one's hard for everyone. It's a really difficult thing to do, and it's an easy thing to say, get good sleep on a slide and put a picture of someone up there having a great night's sleep. It's hard. So unfortunately, what they found is that adequate stress control and sleep can overall slow the aging of your immune system. So as I'm sure many of you know, as we age, our sleep changes with us, specifically our sleep patterns or what we require. So what you required as a teenager for your sleep has really changed. You may be falling asleep earlier, you may be waking up more often throughout the night, and you may spend less time in a deep sleep. And unfortunately, you just can't help that. Most of the time, that's more of a biological thing. But good sleep habits could help change this for you. And we can go to the next slide for this. So what can you do as you age to get good sleep? One of the most important things, and almost like raising a child, is keeping a good schedule and a regular schedule at that. So telling or cueing your body every night when it's time to go to bed. And that is trying to go to bed and wake up at the same time every day, including the weekends. And cues that could help you go to bed or do something the same night is limiting light as you try to go to bed in later hours, reducing screen time as you reach those later hours in the day, limiting daytime naps so you're actually feeling more tired as you approach the nighttime, limiting day as well, and then just a really comfortable sleep environment. Make sure your room is at a temperature that you prefer. And also if you're able to, finding a specific mattress, I know that's hard too, or pillows that you are excited to get into or at least to sleep in. And then this is once again a really hard thing to do, but managing stress is important. I always like to say, you can't take care of other people until you take care of yourself. So just making sure you're speaking with your primary care physician or people in your life to help manage the everyday stress that we all experience. Unfortunately, some more than others, and that's outside of your control. And lastly, review your medications with your primary care doctor. A lot of different medications can actually impact your sleep, whether you know it or not. And a lot of us, as we age, we tend to be on more medications, and it's a lot to keep track of. So just making sure that you review that with whoever your physician or caretaker is. Okay, next is get your vaccines. I also encourage you all to discuss with your local physician or your primary care physician about which vaccines you qualify for. Every year, everyone is welcome to get their annual flu or influenza vaccine, usually offered at rush offices versus you can get them at your local pharmacies, like I said before. You can get your COVID-19 boosters as well, similar to the annual influenza vaccine. You can get your COVID-19 vaccine at the same time. Also, as you age, you start to get offered again the pneumonia or pneumococcal vaccines. The people often think this is related to pneumonia specifically, but they're actually pneumococcal bacteria strains that can cause more so sinus disease, meningitis, different things like that. So that helps protect you from those things. Then, as I spoke about before, shingles vaccine, you do also qualify for the shingles vaccine as you grow older. And that is that skin viral infection that can almost regenerate and cause the really painful, itchy, uncomfortable rashes.
Dr. Mans, would you mind repeating the last portion of that because there was some audio issues?
Yes, of course. Are you able to hear me right now?
Yes, that was good.
Okay, good. Okay, great. Sorry about that. The shingles vaccine portion?
I think it was, yes, when we were towards the end.
Okay, sounds good. Yeah, so as you get older too, you could be offered the shingles vaccine. And I talked about this before in this presentation, but the shingles virus can cause the itchy, painful rash that can occur on your skin and can almost regenerate or reactivate within the body. So it's good to prime your immune system to recognize it and give it the strength to fight it.
Thank you.
You're welcome. Okay, and as we have, it's been a common theme throughout this whole presentation, but getting your routine preventative care is incredibly important. It's important at every single age. But now as we get older and we've had more exposures in our lifetime, it's important to follow up with your primary care physician and do all the things that you can do in your control to limit risks of developing their autoimmune diseases, infections, or cancers. So what can you do? You can try, if you are a smoker, it's one of the hardest things, but quitting smoking is very important for your overall immune system. And if you are currently smoking, I encourage you to talk to your primary care doctor about it because there are ways that you can hopefully break that habit. There are medications that they can offer, support groups, like different habitual or like behavioral therapy talk, working with psychologists. We have so many different tools now in the medical world that we can offer you. So if one thing doesn't work for you, there hopefully would be another. Also protecting your skin with excessive skin exposure. So as we were talking about before, as your cells regenerate, they make that DNA transcript that tells them what to do. Sometimes that transcript can get broken or have mistakes in it. One of those things that puts you at risk for that is sun exposure or sunburns. So just make sure when you're outside, you're covering well, you're wearing hats, long sleeves, and also sunscreen when able. And then as we discussed before too, eating those really nutrient-rich diets, and then keeping physically active as well. And lastly, following up with your primary care physician too for all of those vaccines. So we're just kind of taking everything we spoke about and putting it into one slide. And we can head to the next slide. All right, lastly, this is when to seek professional care. And this is actually what we do here in our clinic, the Allergy and Immunology Clinic, is we see patients who are having more frequent bacterial infections, usually at younger ages, since some of these are generally diagnosed in early childhood. However, some can occur or evolve over time in adulthood. So I just wanted to give you all some tips on what to look out for, what is considered to be abnormal. So if you are getting or catching frequent infections, and these are, I'm talking about severe infections, such as repeated pneumonias, 2 or more in adulthood, like per year, sinus infections, 2 or 3 or more in a year, skin infections, or if you have infections that don't go away with oral antibiotics or those pill antibiotics and you require IV treatment. This usually means you have to go to the hospital to get it. So you can't just go home, take oral or pill antibiotics, and then it goes away. Usually these types of infections aren't able to get eradicated. Or if you are experiencing things such as unexplained weight loss, you can't gain weight, you're constantly losing weight, you're having those persistently swollen lymph nodes like I was talking about up here, it's around the neck and the chin region is really easy for patients to feel if you're feeling like those are big, hard, or if you're getting night sweats where every night you're waking up feeling drenched, that is definitely something to bring up to your primary care physician. And why I say this is because sometimes this can indicate early signs of malignancy or cancers. And it's best to let your primary care physician know as early as possible if you're experiencing these things. And also contact your healthcare provider if you have questions about which vaccines are right for you, or whether or not you have an immune system problem where you may need more vaccines or more protection to boost your immune system function. So just any questions at all, I know that we would all be happy to answer. And that's really it from me today. I hope that this has been beneficial for you all. Tried to keep it at baseline, but of course, if anyone has any additional questions or concerns, I'd be happy to discuss more.
I have a question.
Yeah, of
That's
course.
fantastic. Go ahead.
If you happen to live in a community where you can't get fresh produce every day to, as you say, that we should eat that to help the immune system, would taking supplements help the immune system? If you can't
Definitely.
eat the fresh vegetables every day?
That is such a good question. Really good point. Yes, unfortunately, not all of us have easy access to these produce. But you're right. You can get supplements such as vitamin C, vitamin D, vitamin E, and then also zinc and selenium are also offered at any local pharmacy as well, or you could ask your providers about them too. I will say it's not FDA approved, and what that means is the vitamins aren't approved like medications are, so they're not as well regulated as different medications that you may be prescribed by your doctors. But overall, they should be safe. Just make sure that before you start them, that you don't have any medications that you're on that may interact with the vitamins, because sometimes that can occur.
Thank you.
And I also do think, and I don't want to speak on behalf of the, we have the Rush University internist office, the Triangle building at Rush, and I know they do actually have almost like a food pantry with fresh produce too, if you are a patient there. So I encourage you to talk with your primary care doctor as well if you have some limitations in accessing those foods.
I'm so glad that you said that. I'm so glad that that question was asked. I think, you know, if we are having difficulty accessing some food, it's always good to let our providers know. Especially because there are some programs, or maybe you can be connected to another provider like the social worker and then get you connected to some other resources if indeed in your healthcare system it's not available like in ours, but connecting to those. And the other reason why I like about that question is also there are some, or what we known as food deserts, so maybe fresh produce is not as easily accessible. But then I'm guessing that, you know, the zinc, the selenium, or all the other vitamins that you mentioned can be eaten if it's canned. It's preferable fresh, but maybe sardines, if not fresh salmon. So I know that some of the nutritionists that have been here, they just want us to rinse it so that it's not too salty or things like that, but just being creative about that. Good. Any other question from the callers? Remember, you can always press *6 to unmute, and then can ask *6. I don't see anybody unmuting. So, one question in regards to the autoimmunity. How quickly can that be diagnosed, or how quickly that is usually diagnosed? Or usually there's an exploration and then all of us later, then let's try to see if it is an autoimmune disease or not.
Yeah, that's a good question. Since there are so many different autoimmune diseases out there, the question isn't really linear or straightforward. There are a lot of different presentations that you could have that could be a warning sign for autoimmune disease. A lot of these different autoimmune diseases can be explained or investigated through blood testing. and by seeing appropriate physicians. So what I would suggest, it's a common theme now, talking with your primary care physician about any symptoms that you may have, and they would properly triage you to the right specialist if they were concerned for any sort of autoimmune disease.
Okay,
Mhm.
thank you. And then, does that does the diagnosis spikes of an autoimmune disease, does it spikes after a certain age?
Yeah, so once again, there are so many different autoimmune diseases out there, and it actually changes in the relevance based off of gender and age. So out of the wider range, majority are occurring in adulthood. Usually they can peak around like 30 to 50, I guess. And then also there's another peak usually around that older age that I mentioned. I can't give an exact age, but over 70 is when we start to see some other things as well. And that's just from the natural changes of the immune system, like I mentioned. So broad or short answer is it can come at any age, but it does increase over time, the likelihood that you may develop one.
No, it's so interesting also that to strengthen the immune system, it goes back to many of the things that we consistently encourage people to do, like the health of diet, the physical activity, So it's not only about then strengthening our bones, our muscles, we are also then strengthening our immune system, which is fascinating. Some things that people don't think about, but hopefully you will from now on. There's more to that and then the sleep. Some question about the sleep, because the sleep, as you said, it can slow the age of our immune system. There's a lot of older adults that sleep more than before, but it's not necessarily about the time. I think you said it. It's about the deep, it's deep sleep. How much does that matter? It's not necessarily just being in bed or going to bed or sleeping a nap or anything. It's about reaching the deep sleep.
Yeah, and unfortunately, like I said, just a part of our biology as we age is our sleep patterns just change with it. And so it's harder, or at least not natural as we age, to get that deep sleep. And so when the deep sleep occurs, it's more likely to occur when you're going to bed for long periods, but naps can still be regenerative and beneficial. Just the immune part of it all is a little bit less explored with those naps. Naps are still great, but as long as it's not impacting your ability to fall asleep later at night, and you at least keep that what we call circadian rhythm or your routine. And like I said, early childhood routine is important. Throughout your whole adulthood, routine is just as important. And I think we lose that as we get other responsibilities in life. But just developing that routine and sticking to it, I think, is the most important way that you can control your sleep outside of the changes that just naturally occur.
Good. And then the COVID-19 booster, is that that's annually? That is still recommended to be
that's still offered annually. Correct. And you can ask any of the Rush providers or primary care providers too. I do wonder, it's been a while since I've been in the Rush University internist office as a primary care physician. But I think what we offer changes just based off of what's available in the clinic. But you can ask your provider and say, oh, I'm interested in the COVID booster today. What do you have available, if anything? And they should be able to answer that for you. It doesn't matter if in the past you had gotten the Moderna or the Pfizer. The booster is just the booster. So it doesn't impact what your original vaccine was.
Great advice. And there's also these pharmacies who also offer it.
Correct. Yes. So when you're picking up your medications too, you could also ask the pharmacist what they have available for you and if it's appropriate at that time. Because oftentimes with the influenza vaccine, In the COVID-19, we don't like to wait too long because a lot of these things peak in the winter time or early fall. So usually that's why we give those influenza vaccines or COVID-19 boosters in like the early fall or late summer. So just asking if they have it in stock, and then also if they do have it in stock, if it's an appropriate time to get it from their recommendation.
I think that's it. Anybody, any caller would like to ask one question, an additional question? Otherwise, we are wrapping up. It was great to
Okay.
learn. Oh, go ahead.
I want to ask, can I ask another question? I
Of
didn't
course.
quite understand what you meant when you said that we have the sweats that would affect our immune system when we are doing a lot of hot flashes or what?
Okay, yes, this is a good
Or
question.
did I
So,
misunderstand you?
Good question. I also thought about, wait, what if those night sweats are due to a menopause? But go ahead.
no, that's a really good differentiator. And you know what I'm talking about today, it's really broad. We have many reasons we could have night sweats, like you said, hormonal changes, menopause, those sorts of things. But if it persists or it seems to be something that's really bothersome to you, so it shouldn't be impacting your sleep or quality of life. I think either way, it's really important to just tell your doctor about that too. And they can ask the appropriate questions, or if it's affiliated with those other things that I asked about, like if you're losing weight and you can't gain weight properly, or if you are also experiencing the lymph node swelling or other symptoms. So they'll ask all those other things with it. It's just good to mention it overall, because they could also be like, oh, yes, you are currently postmenopausal. It's normal for you to have a certain level of night sweats. They could help figure out your specific situation, because we're not all the same.
Okay. Because I was asking because I'm past menopause, but sometimes I have still may have those night sweats, and I was just wondering, does that affect the immune system?
It could
Or is
be,
that
I mean, it's hard to say, right? So that's worthwhile to have a conversation with your doctor about, because if it's continuously something that's noticeable to you, it could be indicating that your body's overworking. So it could be from menopause or it couldn't be. So I think it's important to have that conversation with them so they can do all the appropriate screening and whatever else.
Okay. Thank you.
You're welcome.
Thank you. Thank you for the question. Okay, well, thank you so much for this very enlightening information. And thank you for making it very relatable. I love the way that you talk about the bouncers, the first responders, the CIA of the FBI, all of that. Because this information, you can refer it to others, but also you can always go back yourself so that you can review anything that you wanted to learn more about, or you felt that during the presentation you missed a little bit of it. Excellent. So let us tell you a little bit about what is coming up next in Rush Generations. The first program we would like to highlight is Fit and Strong, which is a free workshop that uses flexibility and strength training, aerobic walking, and health education to improve your balance and strength. It is a 24-session exercise. It meets 4-session exercise. It meets 3 times per week for 8 weeks, and they go by quickly. Thus, we have heard how quickly it went for many people that have participated in the past. So don't get discouraged by that. The next workshop will be held in person at our Rush Westside campus, and it will be meeting Mondays, Wednesdays, and Fridays, starting on August 17th, so in about 2 weeks, through November 9th. And it's going to be from 1 p.m. to 2:30 p.m. We also validate the parking if you happen to drive to our main campus. Just give us a call if you would like more information. It's 1-800-757-0202. Then we have one of our evidence-based workshops, which is called Take Charge of Your Health. It is a free 7-week workshop for anyone who is age 18 and older that has an ongoing health condition. The participants in this workshop build skills to gain confidence, better manage their health, and lead a more active and fulfilling life. It doesn't matter that you have a diagnosis, you can still live an active, fulfilling life. And this program gives you all the tools and information so that you can do that. The program includes interactive topics on goal setting, nutrition, physical activity, medication and pain management, effective communication, strategies for working with healthcare professionals, many of the things that actually were mentioned today. So the next workshop will be held in person at the Sankofa Village Wellness Center close to Rush, a few miles from Rush at 4305 West Madison Street. And it's going to be on Tuesdays, starting on August 18th through September 29th in the morning, 9:30 to noon. So feel free to give us a call for more information or to register. Again, the number is 1-800-757-0202. And always, Shaman Senior Voices aims to empower older adults to discuss what matters most to them as they age. It is important to share what matters most to you with your physician, with your loved ones. So we want to learn from you. Please consider sharing your wisdom on why it is important that your healthcare team and loved ones know your goals and your wishes and what matters most to you. So you can scan that QR code to record on a mobile device or a smartphone. And our next lecture is going to be in 2 weeks, August 19. The topic is on navigating the healthcare system. We know that at times it can be a little bit overwhelming or confusing. So we're going to have our colleagues talking about how to navigate the healthcare system. Thank you so much for joining us today. If you have any questions about the lecture or any programs discussed, please feel free to reach out to us. The number is 1-800-757-0202. We would like to also encourage you to have you visit our Facebook page. And we just look forward to seeing you at the next lecture.